The biosurface peel treatment must always commence with your client completing their face mapping consultation card. Discuss your client's health and ensure that there are no contraindications to the biosurface peel treatment. Some absolute contraindications to remember for biosurface peel are clients who are pregnant, taking oral isotretinoin in the past 6 months, waxed in the past 72 hours, or have an active cold sore. It's critical that all clients sign the consultation card and have reviewed and signed the biosurface peel client consent form. This must happen before you move into the treatment space. Begin by elevating your client to prevent product from entering into the eyes. Ensure that you have all necessary items on your trolley set up. If the client is not wearing eye makeup, move directly into the Dermalogica double cleanse that begins with pre-cleanse. Ensure that all your movements are light in pressure to avoid pre-sensitization of the client. Follow with your prescribed Dermalogica cleanser to remove any surface lipids. We also suggest the use of special cleansing gel or clearing skin wash to be able to do this. Next, remove all traces of cleanser with sponges and warm water. Again, use light pressure. We can now perform our face mapping skin analysis. At this step of the treatment, you can also utilize a Woods lamp or black light to help you to identify photo damage, hyperpigmentation, and dehydration. Remember to look for signs of barrier disruption or dehydration, as acid active will absorb more readily in these areas. Also look for signs of breakouts and congestion that you may wish to focus on during the treatment. Follow face mapping by protecting your own hands during the treatment by applying latex-free gloves. We are now ready for step 1. Step 1. Fully saturate a 2x2 gauze pad with PREP solution. Place and hold the gauze pad flat onto the skin and wipe the face gently, following the biosurface peel application method. Keep the PREP solution and all of the products a minimum of 1/4 inch away from the eyes, ears, and lip area. If you're familiar with the biosurface peel treatment, you may apply to areas of concern first, then proceed with the application method. For the application method, begin by stroking across the forehead in zone 2 and zone 1 to the temple. Cover the left side of the forehead and move to the right side, covering zone 2 to zone 3 to the temples. Pay attention to not apply or stroke repeatedly over the same area. Next, move to the chin to zone 12 and stroke out along zone 11 and 9 to the front of the ear. Now come to the corner of the mouth, to the ear, and finally the top of the cheek area, again back to the front of the ear. Repeat on the right side of the face, from the chin to the front of the ear, from the side of the mouth to the front of the ear, and along the top of the cheek. Next, stroke down the nose and then the sides of the nose. Your final area is across the lip and under the lower lip. As the areas of skin with more follicles and sebaceous glands more readily absorb the products, we're applying to this area last. After application, use your fingers to perform gentle circles over the PREP solution. Massage gently and work PREP solution into the skin for up to 5 minutes. Next, wipe the skin clean and dry with a 2x2 gauze. This picks up any residue of the PREP solution. Use light circular motions to gently buff away any remaining product. The skin is now prepped and ready for step 2, which is enzyme active. Again, saturate a dry 2x2 gauze pad with enzyme active. Press the gauze flat to the skin and follow the same biosurface peel application method. Allow enzyme active to dry on the skin for up to 5 minutes. We are now ready for step 3 of the biosurface peel treatment. Apply 2 pumps of acid active to a clean, dry gauze pad. Cover the entire face again using the Biosurface Peel application method and evaluate your client's level of sensitivity during this time by using the sensation scale. Evaluate their level of comfort and ensure that it's appropriate for you to be able to proceed. You can apply additional layers of acid active, allowing the second application to dry up to 5 minutes before applying another layer. Continue application up to 5 times or until the applied solution becomes tacky or if extreme erythema is present. In the event that the skin shows any signs of frosting, stop the acid portion of the treatment and do not do any electrical options. Some other considerations for Biosurface Peel are: if you're a medical professional supervising or performing Biosurface Peel, use your professional discretion when determining amount of layers to apply. A wood lamp can also be used to even out application for each step on the skin. It will show as a purple or white tone showing signs of moisture. Galvanic antiphoresis may be used after applying at least 3 layers of acid active. When using galvanic antiphoresis, ensure that there's enough acid on the skin by testing that your fingers glide over the skin easily. Using the positive polarity, move the electrode over the skin for up to 5 to 7 minutes. Additional layers can be applied after using galvanic antiphoresis, but do not exceed 5 layers. Your client will most likely feel an immediate sensation when you apply acid active. Fanning the skin with a paper or battery-operated fan can help alleviate and decrease sensation and discomfort. If persistent erythema is present, or if the client is uncomfortable, or if frosting occurs, exfoliation has been maximized and the peel should be neutralized and removed. Moving back now to our Biosurface Peel treatment, now remove your gloves to begin the neutralization process. We don't want to transfer any of our past products back onto the skin. Whip half a teaspoon of decelerator into a jelly cup with a mask fan brush. Apply a generous, even layer over the entire area where Biosurface Peel has been applied. Decelerator can remain on the skin until the client is no longer experiencing any sensitivity, which can take up to 10 minutes. Remove decelerator by moistening the hands with cool water and gently spreading over the skin. Focus on any areas of sensation or heat and use caution around the eye and the mouth areas. Remove decelerator gently with damp cotton. If the client has experienced any sensation or heat in a specific area, a cold compress can be applied in the form of cotton pads or a moist damp towel. This helps to draw out any heat or inflammation. Repeat and replace once the compress has become warm to the touch. In the event of extreme erythema or sensitivity, mix 1 to 2.5 scoops of clinical colloidal oatmeal with cool water into a smooth consistency. Apply the mixture with a fan, mask brush and leave on for up to 5 minutes or until the erythema or sensitivity has subsided. Remove with a cool towel. Next, we're going to finish our treatment. Spritz the skin with ultra calming mist. Multivitamin Power Foam can be applied or an alternative eye treatment to the eye area if there are no indications of sensitivity. Apply the prescribed dermalogical moisturizer to your client's skin, and due to the nature, we suggest using a slightly heavier moisturizer than usual. Avoid using active moisturizers from Medibac or Age Smart, as these would be a little sensitizing for the client at this time. In areas of frosting or sensitivity, apply barrier repair over the prescribed moisturizer or intensive moisture balance. Finally, protect the skin with a physical SPF, such as Super Sensitive Shield SPF 30 or Ultra Sensitive Tint SPF 30. Of course, no professional dermatological treatment would be complete without completing your face mapping skin analysis prescription sheet. Review any post-treatment guidelines with your client and of course, make any recommendations for their follow-up care. This concludes our step-by-step video. Of course, all of this information is covered in depth in our Biosurface Peel practical workshop. For additional information, please contact your local business consultant or training center or register here on Dermalogicas Education Center.